Welcome back to the Deep Dive. So today we are unpacking a stack of reports from City Relief, Community Solutions, the Kaiser Family Foundation, and, well, the picture they paint is of a massive system failure.
It's a really heavy topic, but what's fascinating about these sources is how they shift the focus. It's not about individual choices, it's about the machinery of the system.
And that machinery is broken. I kept thinking of this one phrase, a bridge to nowhere. Because this all really kicks off back in the 1960s, doesn't it?
It does, yeah. That's the whole era of deinstitutionalization. The U.S. decided, we're going to close these huge, often inhumane psychiatric hospitals.
Which, on its face, it sounds like a good thing.
The intent was good, absolutely, but the promise was to replace them with this network of community-based care centers.
And there's the system failure. They closed the hospitals, but they never actually built the bridge. The community centers were never really funded.
Precisely. You get this mass discharge of patients with literally nowhere to go. And that vacuum, you can draw a straight line from that policy to what we see today.
Which is that the criminal justice system is now the country's largest mental health provider.
It is. I mean, you're looking at places like Rikers Island or the LA County Jail acting as de facto psychiatric wards.
And they're the most expensive, least effective wards imaginable. We're paying for emergency rooms in jails to handle a crisis that better policy could have prevented.
It really is a system that seems designed to fail.
Okay, but let me push back on that for a second. Because if you walk through any major city, the crisis looks like a mental health crisis. You see people in visible distress. And the stats show, 74% of the public thinks that's the main cause?
Right, and that's the perception gap. The visibility completely skews the reality. When you actually look at the data, only about, say, 21 to 26% of individuals experiencing homelessness have a serious mental illness.
Wow. Okay, so that's a huge disconnect. If it's not primarily mental health, then what's driving this?
It's economics. It's shockingly simple. There's this statistic that is terrifyingly consistent across all the research.
Right.
For every $100 increase in median rent in a city, homelessness goes up by 9%.
9%, regardless of mental health funding or anything else.
Exactly. It's the rent. And you have to remember, homelessness itself is traumatic. The experience can actually cause mental health to decline.
So it's a vicious cycle. The stress of living on the street could create the very conditions we blame for causing it in the first place.
That's it. You're not just losing a home, you're losing safety, sleep, everything. It breaks people down.
And what about the other big myth, the idea that, these people aren't from here, that they all moved to a city for the weather or for the services?
Yeah, the data just completely busts that myth. In places like LA or Seattle, somewhere between 68 and 83% of people are local.
So they're your neighbors.
Yeah.
They didn't migrate into the problem. They were priced out of their own community.
They were priced out. And yet the policy response we're seeing now is, well, it's criminalization, banning encampments, handing out tickets.
Which just makes the problem worse, right? Because a ticket becomes a criminal record.
And that record is a barrier to getting housing later on, or a job. You're just digging the hole deeper for them.
It kind of explains the stark difference you see between, say, New York and California.
It's a perfect example. New York has a legal right to shelter. Because of that, their unsheltered rate people, literally sleeping on the street, is only around 4%.
Whereas California, without that mandate, is closer to 66%.
66%. The policy choices directly determine whether people are sleeping inside or outside.
So if ticketing in jails are just making it worse, the sources all seem to point toward one solution: housing first.
Right, and it flips the whole logic we've used for decades. The old way was treatment first. You had to get sober, you had to stabilize your mental health, and then you could earn housing.
Which seems almost impossible to do if you're living under a bridge.
It is. Housing First says the stable home is the foundation for recovery, not the reward for it. You give them the key first.
And once they're safe, the other stuff, the treatment for addiction or mental health, can actually start to work.
The data shows it does. It's more effective and, in the long run, way cheaper.
So we are actively paying for the most expensive version of failure, when a more effective, more humane, and cheaper system is right there.
Which brings us back to that core question, I think. If all the data proves that high rent is the primary driver of this crisis, why do we keep treating it almost exclusively as a behavioral health problem?
And that's the question we want to leave you with. The next time you see this crisis in your city, ask yourself, are you looking at a series of bad choices, or are you just looking at bad mechanics? Thanks for listening to The Deep Dive.